Okay. So as we start to get going, I want to welcome everybody to our very first virtual event. PCI sends a message of hope, and that's our challenge for today and for the next couple weeks. I'd like to first introduce Bonnie Maratea, our Senior Manager for Web and Digital Marketing, who will give kind of some guidelines of how we're going to operate this morning. Bonnie, if you'd like to say hello.
Hi, everybody. I just want to say thank you for joining us today. I will do my best as kind of a hidden moderator for today's session. Just a couple of reminders. We want, if you can, just to mute yourselves during the presentation. And if you do have any questions whatsoever, feel free to put anything into the chat. And when we'll be sharing a video partway through the program, and we will also include that link in the chat in case there are any problems viewing it over Zoom. And in the very, very unlikely event we have any security problems, or like, you know, we've heard a lot about Zoom bombing lately. We're just gonna cross our fingers, hope that that's not the case today. We've taken every precaution, but if it does, then we ask your understanding if we have to end things early, but we doubt that will be the case. But I just wanted to put that out there. Back to you, Elaine.
Okay, thank you very much, Bonnie. And now it is an honor and a pleasure to introduce Project Concern International's President and CEO, Carrie Hessler-Radelet, direct from Washington, D.C. Carrie,
Hi,
thank
everyone.
you.
Thank you so much. I want to just warn you in advance, I have a 15-week-old puppy that's exiled outside, but if he comes tearing in, I'll try my best not to disrupt things with him. But I just really want to welcome everyone to our first virtual event and our first social media challenge. Thank you all for being here to support PCI, our Global Health Fund, and especially our amazing and creative San Diego students who are with us today. These San Diego students who you're going to meet in just a moment have been supporting PCI through the Walk for Water event for the last 12 years, many of them, many students. They have been helping us to increase awareness and raise funds about our program every single year. This year, because of COVID-19, we had to cancel our Walk for Water event, but that did not stop our extraordinary students. They care so much about the people we serve, and they really wanted to continue to support us, even though they're now at home with their families, like all of us are. So they came up with the idea of a social media challenge that they're going to be sharing with you in just a few minutes. But before we get into the challenge, I want to share just a brief update on PCI and what we're doing to educate communities and respond to the COVID-19 pandemic. First, let me tell you a little bit about PCI. We are a global health and humanitarian organization headquartered in San Diego and working in 15 countries around the world, including right here in the United States. We started right here in San Diego in 1961, and our mission is to empower people and communities to enhance health, end hunger, overcome hardship, and advance women and girls. And as of this month, PCI is now a global communities partner, which means that we can expand our work even more internationally and here in San Diego. And we're really excited about doing even more for our communities right here at home and across the globe. However, COVID-19 is one of the biggest health challenges our world has really ever faced. So I want to tell you a little bit about how PCI is helping our communities respond to COVID-19, both here in the United States and globally. As an organization, we are focused on building long-term resilience of vulnerable communities. And we know that this disease outbreak is having the greatest impact on those who are already fighting hunger and extreme poverty and other serious health conditions. Women and children and families without access to health care, jobs, or clean, safe water are the hardest hit. Our first priority has to be the health and safety of our staff and the people we serve across the globe. But what we have also learned so far is that our communities need us now more than ever before. So as we're trying to keep our staff safe, we're all also really trying to work hard to keep our communities safe. So we've already been taking action to help those most in need and slow the spread of the virus. So let me tell you about a few things we're doing. In India, we are using mobile phones to help gather important information that will help first responders be able to plan and target education, testing, and treatment in several states across that huge and very populous nation. We are leading efforts to design and distribute COVID-19 messages to help communities change behaviors. For example, our community outreach workers are distributing materials with key messages on hand washing, wearing masks, and what to do if family members experience symptoms or become sick, probably similar to what you're hearing about from your health departments. And in our women's economic empowerment self-help groups, our members are tapping into their emergency response funds, and groups are meeting virtually to support each other. The self-help groups are amazing. They're serving as platforms for awareness raising, information exchange, peer support, and livelihood strengthening so that they can keep their own families safe and the families around them. So that's India. In Nicaragua, Guatemala, and Tanzania, where we have some programs supported by the U.S. Department of Agriculture, we have school feeding programs that have had to shift from the school venue into a community take-home and delivery ration system to families that face immediate food insecurities. Hunger is a huge problem for families that live far away from stores, and so you can imagine that food security is a real priority for us. And we're also continuing to educate families and farmers virtually in good agricultural practices and other helpful information so they can continue to keep their families safe while also continuing to grow high yield and nutritious foods. So you can see we're using virtual means to help us do our work. In Kenya, PCI's mobile app-based service, which is called AfriScout, combines community-defined grazing maps with satellite imagery to guide pastoralist herders to the nearest water and vegetation for their herd. These are families that depend on herds for their livelihoods. Think of it as MapQuest for pastoralist farmers. We're sharing messages with the app's users related to COVID-19 and social distancing, and we're also reinforcing those messages at livestock markets and in the villages. And we're doing that both in Tanzania and Kenya. And then right here in San Diego, we're now offering online alternatives for teachers involved in our school-based human trafficking prevention programs, as well as virtual conference sessions for our U.S. Border Collaborative on Infant Mortality. Our Healthy Start program, which supports women on their journey through pregnancy, infancy, and childhood, is sharing information about COVID-19, including information about coronavirus and pregnancy. And we're doing that in multiple languages with local families. And we are providing families with essential items like diapers, infant formula, grocery gift certificates, and other important supplies. We work with the most vulnerable populations in San Diego, including refugees and asylum seekers, and we're doing everything we can to make sure that their most basic needs are met. And we're offering video-based home visits and increasing our contact with local participants in our programs via phone and internet, using people that they know and trust. Just to give you a little story about the work that we're doing in San Diego, this is also through our wonderful Healthy Start program. This is the story of a local military family. Kevin was serving his community overseas when his wife Amaya went into labor. He got onto the first plane home, but he found out when he arrived that he had to be quarantined for 14 days due to government regulations related to COVID-19. And so Kevin and Amaya were so devastated that not only did he miss his daughter's birth, but he also was going to miss the first 2 precious weeks of her life, their little baby Leah. So PCI's patient navigator and doula, Sharda, stepped up to the plate. She supported Amaya throughout the labor and delivery. She ensured that she received the best care possible and gave baby Leah a warm welcome to this world. Sharda also helped Amaya adjust to being a new mom and taught her how to keep herself and her baby safe and healthy, especially during COVID-19. And then once they left the hospital, Sharda kept supporting Amaya and Kevin and providing services through video chat to help them, even though they had to socially distance themselves. She made sure that Amaya received a care package with diapers and wipes and grocery store gift certificates and more, so that she'd have all the essentials she needs for baby Leah. And now at last they're all together again, one big and happy and healthy family. So that's just an example from San Diego of the work that we do, how we're adapting. Thanks to our wonderful donors and staff, PCI has been able to continue to deliver our essential services. And we're shifting our support online to keep everybody safe and healthy during this uncertain time. Responding to this crisis has not been easy, and these unplanned program shifts have presented new challenges to our incredibly dedicated staff. However, we are absolutely determined to show up however we can for the families and communities we serve throughout this COVID crisis. And we commit to continually adapting our programs as needed to meet this unprecedented challenge. So I remain so very hopeful. We are capable of doing extraordinary things when we come together to do good. And there are so many people who are stepping up to the plate right now to make a difference in whatever way they can. I am so heartened to see governments, businesses, foundations, nonprofits, and especially individuals collaborating in new and creative ways at home and around the world. And students, what the students are doing, it's just extraordinary. So many of the actions we must take these days are negative actions. Don't hug, don't stand close by, don't go out of your house. We really need to see some positive actions, actions that can bring us together, even if we can't be together. Actions that are supportive and affirming and loving. We really need hope, and we really need each other, actually. In fact, hope is what brought us here today. As you heard earlier from Elaine, students from La Jolla Country Day, Francis Parker, and the Bishop School came together and got really creative about how they could raise awareness and funds for PCI from home during this important and uncertain time. They put together a unique and inspiring challenge, and I'm so grateful to them. They are awesome. I especially want to thank our extraordinary student chairs for leading this effort. Mia Shue, Nick Del Rio, and Anna Ovchinikova. Please forgive me if I butchered your name. We're gonna send you the YouTube link with the music. It's a phenomenal video. I watched it myself. It's to the music of U2, which, by the way, is my very favorite band. So thank you, Mia, Nick, and Anna, for pulling it together. I know that I am gonna send a message of hope, and I'm gonna be sharing it on social media as soon as we're all done here, and I hope all of you will do the same. Thank you so much. Now I'm gonna ask Mia, Nick, and Anna to say a few words, and I really hope you can hear them. So let's start with Mia. Mia, if you're there, please, let's hear from you.
Hi everyone, I'm Mia Xue. I'm from the Bishop School. Shout out to all the Bishopians joining us today. Thank you all for coming to this event. Now we're going to share our messages of hope. I'm grateful for all the scientists working to find a vaccine and developing new testing methods for COVID-19. I'm also grateful for all the teachers at Bishops who were quick to adjust their teaching plans as we move to distance learning. I'm hopeful for a time when we can all safely socialize with each other in person. Now I'm going to pass the mic to Nick.
Hi, my name's Nick Del Rio, and I've been working with PCI for a few years as an ambassador for Francis Parker, and I would like to express my gratitude for the doctors and nurses working on the front lines, and I'm hopeful for a swift recovery from this pandemic.
Hello. My name is Anna Ovchinkova, and I'm a senior from La Jolla Country Day School. Go Tories, and shout out to Ms. Zevin for all of her great support. Today, I am sending my message of hashtag PCI sends hope and being grateful for organizations like PCI and others who put others first and are trying their hardest to provide for and help out people in dire need during this very challenging time. And I'm very hopeful for everyone to stay healthy, and I look forward to starting college next fall. Thank you so much again, everyone, and we hope you participate in this challenge and share your own messages of hashtag PCI Sends Hope on social media. And now I'm passing it back to Carrie. Thank you.
Thank you so much, you guys. You are rock stars, literally, and I'm so grateful to all of you. This is almost the end of our event, but we want to take a moment to thank our generous sponsors. So I think Bonnie's gonna put up, there we go, our slide that shows the names of all those who have supported us. Despite the fact that we couldn't do the event in the physical sense this year, these dedicated sponsors stuck with us throughout and have been supporters and partners, many of them, for years. And you'll see the names of them on the screen, and we're so very grateful to them. But we're especially grateful for our students whose energy and creativity and passion really drove us to want to continue to do this event, to think differently, think outside the box. And I just am so grateful for everyone who signed in, all of the amazing teachers who support these extraordinary students, family members, other supporters, and of course, our extraordinary PCI staff. Thank you very much for tuning in today. We are so excited to see how you respond to PCI's Send a Message of Hope challenge. I really hope you'll join us. We could not do what we do without your work, without your help, your dedication, and your commitment. Our work among the most vulnerable communities in the world depends on all of us now more than ever before. So thank you, thank you, thank you for all you do. Bye-bye.
Bye. Thank you. Thank you.
And let us know how this went.
Thank
How
you.
you felt about it.
Thank you, everybody.
Thank you.
Bye-bye.
Thank you, everybody.